Assalamu alaikum. A very good morning to you all. This is Dr. Farhana Siddique, lecturer, Department of Community Medicine in Bashundhara Ad-din Medical College. Today I would like to talk about diabetes mellitus. So, sweet noon to all. Now, at first we know about what is diabetes mellitus. Diabetes mellitus is a group of metabolic diseases in which there are high blood sugar levels over a prolonged period. Symptoms of high blood sugar include frequent urination, increased thirst, and increased hunger. If it is left untreated, diabetes can cause many complications like diabetic ketoacidosis, non-ketotic hyperosmolar coma, or death. Short-term but long-term complications include heart disease, stroke, chronic kidney failure, foot ulcer, and damage to the eyes. So that's why we all know about the diabetes mellitus very accurately and appropriately. Now, details about diabetes mellitus. Diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin. There are three main types of diabetes mellitus: type 1 diabetes mellitus, type 2 diabetes mellitus, and gestational diabetes mellitus. At first, type 1 diabetes mellitus. Type 1 diabetes mellitus mainly results from the pancreas failure to produce enough insulin. This is also known as insulin-dependent diabetes mellitus or juvenile diabetes. The cause is unknown. Type 2 diabetes mellitus mainly begins with insulin resistance. It is a condition in which cells fail to respond to insulin properly. The form was previously referred to as non-insulin dependent diabetes mellitus or adult onset diabetes. The primary cause is excessive body weight and not enough exercise. And gestational diabetes mellitus is the third main form of diabetes mellitus and occurs in pregnant women without a previous history of diabetes. Now, we know about the comparison between type 1 and type 2 diabetes. In type 1 diabetes, onset is sudden, is mainly in children occurs type 1 diabetes. That's why it also known as juvenile diabetes. Mainly it occurs in thin or normal size people. Ketoacidosis is common in type 1 diabetes mellitus. Endogenous insulin low or absent. Prevalence in 10%. But in type 2 diabetes mellitus, onset is gradual, mostly occur in adult. Occurs in obese people. Ketoacidosis is rare. Autoantibodies is absent. Endogenous insulin normal, decreased or increased, and prevalence in 90%. Now, sign and symptom of diabetes mellitus. The classic symptom of untreated diabetes are weight loss, polyuria, that means increased urination, polydipsia, that means increased thirst, and polyphagia, that means increased hunger. Symptoms may develop rapidly within a weeks or month in type 1 diabetes, which usually develop much more slowly and may be suitable or absent in type 2 diabetes. In addition, they also include blurry vision, headache, fatigue, itchy skin, slow healing of cuts. Prolonged high blood glucose can cause glucose absorption in the lens of the eye. It also known as diabetic dermatomes. Now, complication. Complication includes long-term and short-term complication. In long-term complication, it includes cardiovascular disease, macrovascular disease like stroke, peripheral vascular disease. And short-term complication includes diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. Diabetic neuropathy is the most common complication in case of diabetes mellitus. Pathophysiology in type 1 diabetes mellitus is characterized by loss of insulin producing beta cell leading to insulin deficiency. The majority type 1 diabetes of the immunomediated nature in which a T cell mediated autoimmune attack leads to the loss of beta cells and thus insulin. Most affected people are otherwise healthy. Sensitivity and responsiveness to insulin are usually normal, but it's mainly occur in children, that termed as juvenile diabetes. In type 2 diabetes, mainly characterized by insulin resistance, the defective responsiveness of body tissue to insulin believed to involve the insulin receptor. In early stage of type 2, the predominant abnormality is reduced insulin sensitivity. The type 2 diabetes mellitus mainly primarily occurs to lifestyle factors and genetic factors. Gestational diabetes mellitus mainly resembles types of type 2 diabetes mellitus, involve a combination of relatively inadequate insulin secretion and responsiveness. It occurs about 2 to 10% of all pregnancies and may improve or disappear after delivery. Though it may be transient, but untreated gestational diabetes can damage the health of fetus or mother. Eventually, it also causes death of the fetus. Risks to baby include macrosomia, congenital heart defect, central nervous system abnormality, skeletal muscle malformation. Increased level of insulin in a fetus blood may inhibit fetal surfactant production, and that causes respiratory distress syndrome. It also causes high blood bilirubin level. In severe cases, perinatal death may occur. Labor induction may be indicated with decreased placental function. A cesarean section may be performed due to macrosomia and shoulder dystocia. Oral manifestation and complication in case of diabetes mellitus. It increased the risk of infection, reasons unknown, peripheral neuropathy, immunological deficiency, high sugar medium, decreased production of autoantibodies, and candidal infection. Emergency management in case of diabetes mellitus. In severe hyperglycemia, a prolonged onset ketoacidosis may occur in nausea, vomiting, abdominal pain, and acetone odor. Difficult to different hypoglycemia and hyperglycemia. Hyperglycemia needs immediate medical intervention and insulin administration, while emergency give glucose first. A small amount is unlikely to cause significant harm. Diabetes mellitus can be diagnosed by demonstrating any of the following: by fasting blood glucose level more than or equal to 7 millimole per liter, plasma glucose more than or equal to 11.1 millimole per liter in 2 hours after 75 gram glucose, and in HbA1c is more than or equal to 6.5% is diagnosed as a diabetes mellitus. Oral glucose tolerance test or OGTT, it is measures the body's ability to metabolize glucose. Most commonly due to check for gestational diabetes, the patient is asked to take glucose and their blood glucose level is measured before and at the interval after the surgery drink is taken. For the standard glucose tolerance test, we should drink 75 gram or 100 gram of glucose. OGTT results: people without diabetes, fasting blood glucose level under 6 millimole and 2 hours after 75 or 100 gram glucose, it under 7.8 millimole per liters. In impaired glucose tolerance test, fasting blood value within 6 to 7 millimole per liter and 2 hours after 75 or 100 gram glucose, it within 7.9 or 11.0 millimole per liter, and it causes diabetes when fasting value over 7 millimole per liter and 2 hours after more than or equal to 11.0 millimole per liter. This is the flow chart that shown the WHO diabetic diagnostic criteria that already told. Now management, lifestyle, medication and surgery. Lifestyle modification হচ্ছে good nutrition, regular exercise, diet control, medication, and surgery. Medication includes oral hypoglycemic drugs and insulin, and surgery হচ্ছে pancreas transplant, kidney transplantation, weight loss surgery. That's all for today. Thank you for your patient hearing. Allah Hafiz.